Hi, I'm Dr. Peter Downey at UCLA Health. I'm the co-director of the Aortic Center and an adult cardiac surgeon. I operate on hearts in adults.
And I am Dr. Bernardo Mendes. I am the co-director of the UCLA Health Aortic Center and a vascular surgeon. I operate on arteries and veins. We are here to discuss aortic dissection and how we can treat it.
Aortic dissections are tears in the inside lining of the aorta. The aorta is the largest blood vessel in the body. It travels from the chest to the lower abdomen. It's made up of 3 layers: an inside layer, a middle layer, and an outside layer. In a dissection, the inner layer tears and the middle layer can degenerate. A weak wall of the aorta can lead to this. Weak walls can be caused by aortic aneurysms.
In dissections, the blood going through the aorta begins to travel in the wall of the aorta. The blood does not go down the main channel of the circulatory system. This means the blood might not be able to get to the organs that need blood supply. The aorta is also at risk of rupture. This can be a medical emergency and usually requires emergent surgery to repair the aorta.
So how can we treat aortic dissections? Aortic dissections often require a special team of surgeons to manage the problem as quickly as possible. First, we make a diagnosis using imaging such as a CT scan. Then, we assemble the team that will care for the patient. Either a cardiac surgeon, a vascular surgeon, or both will take the lead.
We can manage some aortic dissections using stents and catheter-based interventions. Whenever possible, this is our first-line treatment. This type of repair is often quicker. It can restore proper blood flow without major open surgery.
We start by making a puncture site in the blood vessels in the legs. From these access sites, we can use special imaging and stent devices to cover the torn segment of the aorta from the inside. Then blood can flow through the stent and get to where it needs to go again.
Other dissections, such as those in the part of the aorta in the chest, require emergency open traditional surgery to repair. These are often life-saving surgeries. Doctors are working hard to develop stenting or endovascular techniques to repair those aortic dissections as well.
When a dissection is in the chest, we often need to use special surgical techniques to protect the heart and the brain while we repair the aorta. During surgery, we remove the abnormal part of the aorta. We replace it with a surgical tube graft. We sew this in place in healthier parts of the aorta. These surgeries usually take between 4 and 8 hours. Patients can be in the hospital for a week or more for initial recovery. Recovery may also involve other medical teams and time in the ICU, depending on the extent of the surgery.
If you have had an aortic dissection repair, or you're considering surgery for an aortic aneurysm, talk to your doctor. You can also reach out to us at the UCLA Health Aortic Center for more information.